Namaste, Dr.KMK Reddy. Today we'll try to understand an important aspect in the pandemic. We all know the pandemic is an ongoing process as of now. There is a lot of apprehensions, fears going on in the society about the pandemic. When it comes to the pandemic and a heart patient, it's a big dilemma. When to see the doctor, when to undergo whatever the procedure, like either angio or angioplasty or balloon operation or surgery or open heart surgery, all these things. This is a very important discussion in the sense we don't know when this pandemic is going to stop or disappear. When we observe in the last 15-16 months, we could only understand it goes up, comes down, goes up, down. We don't know whether it is going to completely stop or is it again going to rise like a third wave. We don't know, everybody's imagination. So your imagination is as good as my imagination. Having said this, there will be naturally an apprehension when to see a doctor or a cardiologist for the either periodical visit, which is due, long pending, or when to undergo the planned procedure, because definitely there are good number of procedures kept on hold either by the patient or by the doctor or by both. So this is a very common situation we are facing as of now. And most of my clients and the patients ask, sir, is it okay for us to come and visit you in person? I can definitely say, since we don't know what is going to happen in future, like tomorrow or day after a month or 2 months, how comfortable, how safe they are. We have to time at least a reasonably safe period to see the doctor in person and take a decision. Yes, I 100% believe these days are reasonably safe days to see the doctor in person. It's not my sixth sense feeling. There is a scientific evidence saying that at least a low incidence of cases is there for a quite number of days. Hence, the viral spread is not that huge in the last 15 to 20 days or 1 month. I strongly believe at one day or other we need to see our doctor. We can't postpone our health issues, more so cardiac patient. So it is a reasonably good time, it is a reasonably safe time to see the doctor in person to avoid a huge gap like 1 year, 2 years without seeing the doctor. Sometimes if you maintain so much gap, there is a possibility that we may land up with the complications of the medication what we have been using. 1. 2. We might have developed a new disease. We might have also developed probably the progression of the disease itself, which we are not able to understand. So having got so many possibilities, why to give a scope for them, or for the disease to progress, or for the medications to be unaudited? We have to see the doctor as our periodical visit. I know that majority of the patients have postponed with a good intention because the things were not that comfortable. Hence, I strongly suggest that probably the days will come as a pre-COVID days, like before 2020, like 2019 scenario. The scenario which was there in 2020, we don't know when we get the same scenario now. Since we have a lot of confusion or unexpected days to come, at least we have to time reasonably a period, reasonably safe time. I don't say 100% safe, reasonably safe time to have our long pending visit to the doctor. So I sincerely suggest all people, please visit your cardiologist if you are a heart patient. If you are on follow-up with your own cardiologist, please don't waste time. Please see the doctor as early as possible to plan or to have a better plan of the management or better titration of the medication or better optimization of the existing medication too. These are the important things that need to be looked into when we see the doctor as a follow-up. So this is an important thing. These things are very much essential for all the patients who are there on long-term therapy. If people are on the long-term therapy, if some emergency comes, there is nothing like a timing. We need to rush to the emergency room. We have to go and see the doctor. There is no second thought about it. For an elective procedure, probably, since we don't know, there is a lot of fluid state or a lot of unpredictable situation in future too. Rather than waiting months together, years together, just like that, at least there is some breathing time given now. See your cardiologist and discuss with the cardiologist what is going on with your health, with your medication. Suppose if in-person visit is not possible with your doctor, at least an online consultation, thorough consultation is required. So I want to advise or to suggest everyone, if your visit is long pending, see your doctor. If you have a new symptom or if the symptom existing is worsened with medication, you have to see the doctor. If you are so stable, it is fine. Or if some procedure is long pending on you, don't wait for the best days to come, because we cannot predict when is this best day that is likely to come. Ladies and gentlemen, I sincerely request, plan your visit to your doctor to have a better follow-up, a better decision, a better medication. Thank you.
ప్రస్తుత విపత్కర సమయంలో అందరం ఆందోళన చెందే ముఖ్యమైన పరిస్థితి అంశము ఏంటంటే, నేను నా కార్డియాలజిస్ట్ని కలిసి చాలా రోజులైంది. నా మందులు ఎలా పనిచేస్తున్నాయో తెలియదు, నా ఆరోగ్య పరిస్థితి ఎలా ఉందో అస్సలే అర్థం కావట్లేదు. నేను బాగున్నాను అని నడిపిస్తున్నాను, కానీ నిజంగా బాగున్నానో లేదో నాకే తెలియదు అని అనుకోవడం సర్వసాధారణమైన విషయం. అందుకే అంటున్నాను, మనకు ఈ పాండమిక్ ఏ రోజు పూర్తిగా పోతుందో తెలియని పరిస్థితి, ఎవ్వరికి అంచనాలకు అందని విచిత్రమైన స్థితి. కాబట్టి ఫస్ట్ వేవ్ తగ్గింది, సెకండ్ వేవ్ వచ్చింది, కాస్త కోస్తో ఇప్పుడు ఊరట కలిగిస్తోంది. అది తగ్గి ముందు రోజుల్లో మూడో వేవ్ వస్తుందో లేదో మనకు తెలియదు, కానీ భయాలు మాత్రం విపరీతంగా ఉన్నాయి. కాబట్టి విజిట్స్ని మరీ దూరం అయ్యేటట్టు చూసుకోకుండా, స్టేబుల్గా ఉన్న వాళ్ళు పర్వాలేదు అనుకుని ఆన్లైన్ కన్సల్టేషన్స్తో సరిపెట్టుకున్నప్పటికీ, మిగిలిన వాళ్ళు వ్యాక్సినేషన్ వేసుకున్న ఆసుపత్రులు, సిబ్బంది పనిచేస్తున్నారు. కాబట్టి మీరు కూడా చాలా వరకు 2 డోసుల వ్యాక్సిన్స్ వేసుకొని ఉండి ఉంటారు. కనుక ఈ సమయం సరైన సమయం ఆసుపత్రిని సందర్శించడానికి, డాక్టర్ని సందర్శించడానికి సరైన వైద్య సలహా పొందడానికి అని నేను నమ్ముతున్నాను. ఈ సలహాని సూచనని మీరు గమనించగలరని మనవి.